On June 15th, President Joe Biden signed an executive order advancing LGBTQ-inclusive policies in healthcare, schools, and housing. The order also denounces some recent state legislative attacks on the LGBTQI+ community. While the order addresses equality in a number of areas, there were some specific initiatives focused on healthcare, and we're going to review a couple of those here, including expanded access to care, guidance to states on model policies, denouncing the so-called conversion therapy, and protections for older adults in long-term care settings. Now let's start with that expanded access to care. The order directs the U.S. Department of Health and Human Services to issue guidance for states to expand access to affordable, comprehensive health care for LGBTQI+. It explicitly charges the U.S. Department of Health and Human Services with promoting the expansion of gender-affirming care and mental health care. It also directs the department to address health disparities for LGBTQI+ youth and adults. Let's talk about some of that guidance to states. The order directs the department to address harmful and discriminatory state legislative attacks on LGBTQI+ individuals, including children, youth, and their families. To meet this goal, the order directs the department to develop and release sample policies for states, and they say this will help safeguard and expand access to health care. Now let's talk about how they're addressing conversion therapy. The order calls on the Secretary of the U.S. Department of Health and Human Services to establish an initiative to reduce the risk of youth exposure to so-called conversion therapy. This initiative includes a couple things. First, consider guidance clarifying that conversion therapy does not meet criteria for use in federally funded programs. It also includes increasing public awareness of the harms and risks of conversion therapy and increasing availability of assistance and training to healthcare and social service providers. And finally, protection for older adults. The order says the department has to develop and publish guidance on non-discrimination and other rights of LGBTQI+ older individuals in long-term care settings. And it also directs the department to publish what they call a Bill of Rights for these older adults to make sure that they and the providers in long-term care settings know what their rights and responsibilities are. The order has been lauded for addressing healthcare disparities and discrimination experienced by the LGBTQI+ community. And while some people say it's a step in the right directions, others will say it just doesn't go far enough. There is still more work to be done. For now, you can read the text of that executive order. We link to it in its entirety in the description below.